This brain is really nice for looking at the arterial supply. So we already saw the cut profiles here of the internal carotids coming on both sides. And the internal carotid has its main continuation as the middle cerebral. So you can see that heading between the frontal and temporal lobes. Down here, between those lobes. You can see that down in there. So that's the middle cerebral. And it also continues under the optic chiasm here to supply the anterior cerebrals, which go between the hemispheres right here. So here are the anterior cerebrals, and they do join at the midline right here at this anterior communicating artery. You can see that connection point right here under the forceps. Very small. They're almost touching each other on the midline there. And then this specimen's a little odd in that the communicating arteries are really big. So this should be a very small branch. And so in this case, the internal carotid is supplying all the blood for the posterior cerebrals right here on both sides. So this again should be a small communicating artery right here, and it's not. It supplies this big posterior cerebral artery. And then what's a small branch is what comes off the basilar. So here's the basilar on the midline. And normally the basilar supplies the posterior cerebrals, but in this case, they're just very small communicating vessels. So instead of the basilar supplying the posterior cerebral, the internal carotid is in this specimen. So then here are the superior cerebellar branches, and that really reflects the top branching part of this person's basilar artery. So here's the basilar, and here are the posterior inferior cerebellar arteries. Here are the vertebrals, pretty big on the left, pretty small on the right. And then on the left, you see a posterior inferior cerebellar branch coming off. I don't really see one on the right, or it's small. Zooming in here a little bit, I wanted to point out one final thing on this brain's vasculature. It looks generally pretty healthy. I don't see white spots, which would indicate atherosclerotic plaque, except for one location. I don't know if you can see. It's actually brittle right here, and it sort of broke open. But here is a location where there was probably a buildup of material on the intima of the vessel. But it doesn't look like there was a blockage there or anything. So on some of these brains, you could see plaque locations on the arteries. But otherwise, this looks pretty healthy. Here's the circle of Willis in a different brain. You can see, just to get your orientation, here are the internal carotid arteries coming in. And it's got a medium-sized posterior communicating on the left, and on the right, it's got a much bigger one, which again provides most of the blood supply to the posterior cerebral artery right here. Much of this internal carotid supply coming in continues on, as you can see here, as the middle cerebral artery, right between the frontal and temporal lobe. And here are the anterior cerebrals, this little communication between the two, right on the midline. And in this case, I don't know if you can see it clearly in the video, there's a bit of yellow, sort of fatty plaque on the inside surface of a bit of the basilar artery here. And also here at this breaking point of the internal carotid. So this person had a bit of plaque. I don't have the medical history for the individuals who donated these brains, but this person might have had multiple CVAs, some diseased vasculature for their brain, or some other sort of generalized degenerative process. Because if we back out here and take a look at the brain surface, let me see if I can get a better focus here. both right and left cerebral hemispheres had abnormally deep sulci. This is not normal. And it's very conspicuous in the left motor strip region and possibly even into Broca's area in the frontal lobe here. So this is just arachnoid. But if I move this out of the way, you can see this void where there's now missing brain tissue. So this person likely had hemiplegia and aphasia resulting from this degenerative process, whether it was stroke or some other more generalized degenerative process, I'm not sure. But normally, the gyri and sulci should be more like this. This is what I presume is a healthier brain, with the frontal lobe here, temporal lobe, superior, middle, and inferior gyri, the precentral sulcus, or gyrus rather, the postcentral gyrus. So this is parietal lobe here, occipital lobe here behind this notch. So this is a primary visual cortex back here. The cerebellum, the arbor vitae. This is a nice midline view showing the corpus callosum, genu and splenium. The anterior commissure here, another fiber tract going between the right and left sides of the brain. Here's the pons, and the medulla. The fourth ventricle would be in here. The cerebral aqueduct would come right through here. And in here would be the third ventricle. Here's the lateral ventricles. The head of the caudate nucleus right here, sort of the medial bulge inside the ventricle. This is the optic nerve in chiasm. So this is the hypothalamus here. Cingulate cortex and gyrus. A couple of additional features here. You've got the temporal lobe here, and this bump on the medial edge is the hippocampal gyrus. And this very well might be the mammillary body here, just posterior to the optic nerve. Here's the olfactory tract, or at least part of it. And then, if you can see this pigmented region here, that's the substantia nigra on the ventral region of the midbrain. And then the roof of the midbrain is made up of the superior and inferior colliculus. If you can see those bumps there. So for vision and hearing, respectively, the pineal body would sit right here, and it's missing in this specimen.